Hi, my name is Dr. Todd Cunningham. I am a school and clinical child psychologist, an associate professor in the teaching stream here at OISE, the University of Toronto, and one of the supervisors at the OISE Psychology Clinic. What really makes the OISE Psychology Clinic different than other clinics is the fact that we are able to integrate both research, clinical practice, as well as training into one space. It is this wonderful expertise that we have through and knowledge that we've gained through research that we can bring to the clients that we serve within the clinic. In addition, we also have the ability to have a fantastic training opportunity for the next generation of psychologists and psychotherapists. Though you might be working with a student, that student is supported by other registered psychologists and psychotherapists who are expert within the fields. You have other doctoral level clinicians who are supporting that individual. So in the end, you might be seeing one person in front of you, but you actually have a team that is supporting you and your loved ones when you're here at the clinic. One of the great opportunities that we have in the area of child psychology is the ability to really understand how students go about learning and why do students have challenges within school or at home. Through the research that we're conducting, we're able to develop new assessment techniques to be able to understand what is underlying a child's learning challenges. For example, individuals who are immigrating into the Toronto area, often it has been told to them that they have to wait for years before they can be able to understand their learning profiles and why they might be having difficulties because they don't speak English enough. What we know through the research that has been conducted here is that's not the case. We can quickly begin to be able to understand what is the underlying issues, what is the linguistic challenges, what is underlying cognitive challenges, and how do those go together to inform the academic difficulties a child might be having at school. If a child's having difficulties with reading, we know what to do to be able to help develop their reading abilities, to either remediate it to bring them up to grade level, or if that's an area of challenge, to be able to circumvent that so that they can begin to engage within the work that others are able to do. Often, parents come here because they have been asked to come here by the schools. The school teachers are frustrated, the parents are frustrated by the behaviors that their child is having. And often the kids are feeling bad about themselves because they know they're not behaving the way that they should, but they're themselves not sure why they're acting out within the classroom. We're able to start to unpack why that problem exists. Is it due to a linguistic problem? Do they just not understand what the teachers are saying because they don't speak English as their first language? Is it a cultural piece? Do they not understand the customs that are expected within this classroom? Or maybe it's due to trauma. Maybe they having immigrated from a war-torn country and they just don't feel safe within this environment. Maybe the work that they're being given is actually beyond their abilities because they have an underlying learning disability, or a teacher's asking them to pay attention for too long and they can't due to ADHD. Understanding that underlying issue is really important so that we can provide the best recommendations to be able to support that individual. In collaboration with the parents, with the student, and with teachers, we're able to bring together our knowledge of forming an intervention plan that's going to support those individuals. And often those interventions can take place here. If the student is experiencing high levels of stress due to life circumstances that have led to them to develop anxiety or maybe depression, then we're able to see them through therapy and be able to help them feel better about themselves. If the underlying issue is due to an area of academics, we can be able to identify that weakness and through our academic intervention services be able to help teach them how to read, write, do math, or to be able to work around those areas of challenge so that they can do the same work that their peers are able to do. It is at the OISE Psychology Clinic where we have the ability to know through the research that happens at the Institute. We have amazing clinicians who are being trained and become some of the world leaders in clinical services, as well as we have a place that's open to the public to be able to provide those services. It is through the OISE Psychology Clinic that we really are making a difference in mental health in Ontario.